I'm Vicki Hogarth, and this is NewsBreak26 in Southwest New Brunswick. The provincial government has lowered the age of eligibility for the second COVID-19 booster shot to 18. This comes at a time when COVID-19 cases are on the rise in New Brunswick. Joining me to discuss the current state of the pandemic in the province is Chief Medical Officer of New Brunswick, Dr. Jennifer Russell. Dr. Russell, thank you so much for joining me today.
It's so great to speak with you, Vicki.
Can we talk about the uptick in number of new COVID-19 cases in New Brunswick? What has likely led to this increase?
Well, there's many things that can impact the increase in cases. We know the risks are higher when people aren't getting vaccinated. We know the risks are higher when people spend more time indoors as opposed to outdoors, masking, all of those things. The big message right now is that our hospital system was trying to be in a bit of a slowdown so that we could give a chance to all those tired healthcare workers to have vacation time. It's so important for them to get rest. So we really want to be able to function with respect to the capacity of the hospital system right now. And so we have just opened up our eligibility for people age 18 and above to get that fourth dose. We still have a lot of people who haven't had their third dose. We do know that there are children who are eligible for their second dose right now. So whatever dose you're eligible for, if it's been 5 months since your last one, now's the time to get it.
On that topic of vaccines, we know protection wanes over time, but for people who are eligible, is there any logic in waiting for fall to get a third or fourth dose, or should you get it when you're eligible?
Our advice right now is to get it when you're eligible for many different reasons, including the fact that we know that we do see a difference between whether or not you get COVID and whether or not you have severe symptoms and require hospitalization. People who are 60 and above are the people most at risk for having bad outcomes and severe symptoms.
Okay. And in terms of the BA4, BA5 subvariants of Omicron, what do we know about these subvariants, and what percentage of new cases do they tend to be in New Brunswick at this point in time?
So we know that both of those subvariants of Omicron are both much more transmissible than earlier versions of Omicron. So I think BA4 right now is about 35% of the cases, and BA5 is about 45% of the cases. Let me just double check that because I have it in front of me. 32% of samples are that we're sequencing are BA4, and 45% of the samples are BA5.
Many New Brunswickers at this point have had Omicron. Do we know what percentage of New Brunswickers have been infected, and what level of immunity does it provide if you have recovered from COVID-19, and for how long?
So we do know that people can get reinfected with whatever version of COVID that is presently circulating. So we expect people to get reinfected. Number two, around the risks in terms of the immunity that you get from a COVID infection versus a dose of the vaccine. We do know that both of those things do provide some protection, but that 5-month mark, you do need to get whatever dose you're eligible for next for the most protection.
Just over half of New Brunswickers have had a third dose at this point, but that is a significant drop from those who've had 2 doses, which is around 90% of New Brunswickers. What do you think has led to this decrease, and are you concerned?
I am concerned. I think 2 things happened. I think one, people had bad side effects perhaps, and they weren't really keen to rush out and get a third dose if they couldn't see the benefit in that. There is truly a benefit in getting that third dose because we know that the immunity after 2 doses does wane. And so that third dose is that extra protection to boost your immune system so that whatever variants are coming out, you are protected from. Again, that's what helps protect our healthcare system and prevents hospitalizations and bad outcomes.
And on that topic of hospitalizations, how are hospitals managing hospitalizations while also factoring in vacations for staff as well as staff infections right now?
So there was a planned slowdown in the healthcare system this summer for exactly that, to allow people to get that rest, to get that vacation time that they really need to have. And so to be able to provide that for them, obviously with cases going up, they have really have to keep a close eye on how they manage that from hospital to hospital and within each regional health authority and then across the regional health authority. So they're working on that. We're working with them. But the message right now is get whatever next dose you are eligible for if it's been 5 months or more.
And what are the trends you're seeing in terms of those who are hospitalized for COVID-19? Does it have anything to do with vaccination status? Are there trends in age groups or immunocompromised individuals?
So that actually differs based on what is happening with regard to the community and community transmission. If community transmission is high, if there are a lot of cases circulating in the community, then what you'll see is people of different ages who are hospitalized for other things that either get COVID while they're in the hospital or they arrive at the hospital to get treated for something other than COVID, but they concurrently have COVID at the same time. And so what that means for the hospital system is that you are taking up extra staff and time with the donning and doffing of the protective equipment, et cetera. But what we do see is when case counts are low, those people who are hospitalized with COVID and require that extra care are people 60 and above.
Okay, and finally, would you characterize what we're living through right now as a sixth wave? And do you have any projections for what we might experience this fall?
So everybody has a different definition of what a wave is and which wave it should be called. And so I'd rather just stick to the fact that this is a big increase in cases. We are concerned, and that concern has led us to open up our fourth doses to 18 and above. And we want everybody to get whichever dose of the vaccine they're eligible for if it's been 5 months or longer.
Okay, well, thank you so much for speaking with us today, Dr. Russell.
Thank you, Vicki.
That was Chief Medical Officer of New Brunswick, Dr. Jennifer Russell. That's all the news I have for you. For more stories and online exclusives, follow us on Facebook at CHCO.TV.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.